Hello and welcome to Bristol Health Cares. I'm your host, Kurt Barwis. I am the president and CEO of Bristol Health. This program is for you. And it's really about trying to answer questions you may have and really didn't know who to ask. We are going to bring to you professionals, doctors, surgeons, other healthcare professionals, maybe people that you've never talked to before or met before. But the goal is to really help you understand how to access care when you need it. This program is really for you. So if there is something that you want to learn about or a guest that you'd like me to host on this show, write us and we'll try to make that happen for you. So enjoy the program, Bristol Health Cares. Welcome to this episode of Bristol Health Cares. Today, I have a very, very special guest with me, Patrick Smith. He's a primary care physician in Bristol at the medical center. And Patrick Smith is a Bristol born and raised resident who came back to provide medicine to the community. Patrick, welcome. I should say Dr. Smith, I'm sorry, I apologize.
Patrick, Dr. Smith, whatever is fine, but thank you, Kurt.
So tell us a little bit about your journey.
Well, about 13 years ago, I graduated high school from Bristol Eastern High School. I then went to undergraduate and I studied chemistry and math at UConn. I came back for a couple of years and improved my resume, and I ultimately went to Quinnipiac for medical school in 2018. And after that, I went down to Stanford Hospital for the last few years to complete my residency in family medicine with the Stanford Hospital Columbia Family Medicine program.
That's awesome. So 2018 Quinnipiac. So that was, when did they start that school, that program?
I believe I was the sixth class.
Sixth class. I know I feel like I've been here now forever, and it just seems like it was yesterday that they started that program. I was very impressed by, I've toured that program. I especially like the cadaver area. It's like the most high-tech thing I've ever seen. Really, really amazing. So you really enjoyed that program there?
Yeah, I felt really blessed to be able to stay around. You know, there aren't as many medical schools as there are normal colleges, so I was willing to go outside of the state if I had to, but thankfully I was able to get, a good opportunity at Quinnipiac, and I felt like I was, very well educated there, and everyone was really willing to help, so I feel like it was a really good experience.
So you have some, obviously the family ties and roots in Bristol, Connecticut. Tell me a little bit about your family. I mean, it's pretty extraordinary things that they've accomplished in the community.
Yeah, so I guess, starting my grandfather, his name is Roland Dumont. He's a pretty well-known guy around Bristol. He started an insurance agency out of his attic many years ago. Eventually, he developed it into, a full-blown agency, which still sits on Farmington Avenue in Bristol. My mother was the founding executive director of the Main Street Community Foundation in Bristol. She worked on various, philanthropic projects, and she was always entrenched in, I think, some of even the hospital board activity. My father's a practicing attorney in Bristol. He's, probably a little closer to retirement now than not so, but he's still practicing. My sister's also a practicing attorney in town, Megan Smith, and my brother is has a real estate agency in Bristol, Tier 1 Real Estate. So, we have a lot going on in town.
Yeah, I'll say.
Yeah. I think we've always kind of prided ourselves on, giving back to the community and keeping our businesses here because, we kind of live and breathe what Bristol stands for.
Yeah. It's a pretty common thing in Bristol, I find, having relatively new 19 years and living in Bristol. But there's a lot of Bristol pride, and there's a lot of the folks are committed to the community, like your family. It's really extraordinary to kind of experience that. So tell us a little bit about your practice. What are your goals? Well, before that, how about what made you go into primary care?
So I think I've always kind of enjoyed fostering relationships. There are areas of medicine where you don't have patient interaction so much. There are areas of medicine where you have a lot of patient interaction, but you don't really get continuity. And I liked patient interaction and I liked continuity. So primary care is perfect for me because I get to form a relationship with my patients. They know me, I know them, and they trust me. So I think that relationship building was a big part of it. I also feel like people lean on their primaries, in times of hardship and things like that. So I always saw myself in that role.
So family practice, right?
Yes.
So what age range are you taking care of? What's your interests?
Yeah. So, I was trained to take care of, basically newborns to the very, elderly people. And I'm still comfortable to do that. Right now in my office, I'm just seeing, 18 and up, but in December, I'm going to start doing some hours in the pediatric office as well. So I'll be seeing some, newborns to 18-year-olds there. So I'll get a little bit more of my full scope of practice.
So some family physicians actually deliver babies too, right? So is that not part
Yes.
Do they still train that?
They do, and I delivered about 40 babies during my residency, but that part of my practice I am going to let go.
Okay, I just thought I'd ask. So,
yeah, no,
so they say it's cradle to grave for family practice, and it
yeah.
truly can be that. So
yeah, I've heard womb to tomb. That is another,
Womb to tomb, right,
another kind of axiom. But
I may actually use that in the future. I like that better. So
yeah, it's all yours. I don't own that.
So you've been on board now since July?
Yeah, so I started in the last week in July, just orienting. I started seeing patients the following week, so I've been seeing patients since the first week in August, and everything has been smooth so far.
Yeah. So now, interestingly, you're also doing inpatient medicine too, which is kind of something from the past for a community-based physician.
Yeah, during my residency, I was comfortable with inpatient medicine, meaning hospital medicine, and outpatient medicine, meaning like the primary care that we've been discussing. I didn't want to lose those skills, and I think it's important to be able to, treat people that are critically ill, which is something you don't have happen in the office very much, versus in the hospital, that's a kind of a daily thing. So I wanted to keep all areas of my knowledge base alive.
That's great. And so when you think about, coming back here to practice, what do you think about the construct that we have, the medical center, the hospital, how things have changed over time? I mean, you grew up here, so Bristol Hospital and the system was much smaller a long time, not that long ago, but it's really developed and grown. And the medical group, for example, now has over 100 providers in it, 100 physicians and APPs. Is that surprising to you? I mean, how's it feel?
So I think, obviously, I told you I started med school about 7 years ago. The transition to kind of larger hospital systems had already started at that time. And I think Bristol adapted well. They're, going the way of the world, which is how Bristol stays an independent community hospital, is to kind of expand a little bit and become more of a factor in, surrounding communities as well as Bristol. So, I think obviously you still get that small community hospital feel where everyone knows you, but at the same time, we've kind of done what we needed to do to be modern.
Yeah. Yeah, I mean, it's funny you say modern because a lot of people associate, small community hospitals like us with technology that may be dated. But the truth is the technology at Bristol is state of the art and some of the most advanced stuff. I mean, we were the first hospital in Hartford County to have the Da Vinci robots. So we are able to stay current with the latest and most importantly, the best technology for taking care of the patients. So you get to collaborate in a medical center with a whole bunch of specialists, which is kind of also unique to today in today's world. How important is that to you?
Yeah, I think, plenty of my patients see specialists in various areas, and, on a daily basis, I see these people, we talk about things outside of medicine and patients and things like that. So we have a good relationship. And I think that, when something comes up, I have questions, they have questions. We can easily pick up the phone, and it's a personal conversation as well as a business conversation. So I think that's fostered a good environment to, give the patient a cumulative care rather than just kind of, you go see this doctor, they say one thing, you go see the other doctor, they say another thing, and then they never talk to each other.
Yeah, I mean, that for me personally, that's one of the reasons I stayed here, because I feel like, you know, that what we have is really unique and special in that, you know, it's not this electronic, you know, secure texting. It actually involves having a real conversation with specialists, primary care physicians, others, to do what's best for the patient. And I feel like it's one of the reasons the quality of care and the outcomes are so good at Bristol Health. So I'm advertising for myself here, by the way. So it's okay.
I think it sells itself, but you're doing a good job.
So Dr. Smith, so today, in terms of what you see in our community, like, what are the things that, you know, that really are very prevalent? You know, we have a little bit of an aging community. We also have a lot of kids, sports and things like that. So what's in your practice? What do you see like top of mind, and how do you approach those things?
Do you mean like what kind of conditions am I seeing the most commonly?
Yeah.
You know, I think if I had to name one thing that is a battle for the majority of people, it would be, you know, weight management and keeping a healthy weight. You know, I think people are always looking for strategies to improve their fitness, improve their overall health. And, you know, I think that's one of the most common things that comes up, you know, in my discussions with my patients, of just, you know, hey, I'd like to lose some weight. Like, how can you help me do that?
Yeah.
You know?
So it's interesting. So then that conversation, there's many conversations that really should start with a primary care physician. And so, I mean, now we have medical weight loss, which is very prevalent. We still have access to surgical weight loss. We have a full cadre of nutritional counselors and things like that. But it sounds like, from what you're saying, that people are less hesitant to talk about those things. They really are bringing it right up, as opposed to things like incontinence and things that people don't talk about and probably need help with. So when somebody asks you that, you know, how do you approach that conversation with them?
So, you know, at first we talk about things that have happened in the past, because obviously right now I'm still meeting my patients. So I just want to know what their journey is. You know, that's an important factor in what I decide to do next, because, you know, if someone says to me, well, you know, I've considered using Ozempic or something like that, then, you know, then I already know they've thought about that, and they might say, well, I don't want to start with that, right? Because I thought about it, or my friend didn't like it, or something like that. So that's the first step. The next step is to kind of just talk about their lifestyle a little bit. You know, what is their day-to-day like? Is there something that they can identify that they know deep down that is probably not the best for their goals in the future? You know, and once, you know, you know their journey, and you know kind of what their life is like, you can kind of approach it from that angle and decide what might be the best next step for them.
Yeah. I mean, it is a journey, and I think, you know, the really getting out next. So I'm post surgery now, 5 weeks with Dr. Bagdasarian, and so I haven't been able to do very much, but I walk every morning, and it's quite interesting to see how many people in Bristol walk. The only thing that I hesitate is the dogs that they are on chains, but they come out and just scare the bejesus out of me. So, but it's a beautiful community too. So there's tremendous trails and opportunity to get out and exercise and do things. But the medical weight loss program and then the surgical weight loss program at Bristol are both very, very well developed, and really, I think for the community, a very positive thing. And then we have our retail pharmacy too, which can actually do all the qualifications if you really do go into the medical weight loss. So how about sports? You know, so you said 18-year-olds. So how do you see that really evolving in your practice? Are you interested in doing, because some family physicians really do focus on sports.
Yeah, you know, obviously growing up, I was an athlete myself. I played baseball and football in high school. I was more of a baseball player than a football player. But, you know, obviously just counseling athletes on safety, precautions, hydration, things like that. I love doing that. And a lot of times, you know, in my previous practice, I was doing a lot of sports physicals to clear people to participate in sports. And I anticipate that, you know, over time, I'll probably be doing some of that as well. So, you know, I think I'm looking forward to just, you know, seeing the people that want to be active, that want to play the sports, and counseling them how to do it in a safe way and how to do it in a way that, promotes healthy living, even after maybe they have stopped playing that sport.
One of the interesting things is we have a well-developed orthopedics program, and Dr. Labashi was on here, and he was talking about avoiding joint surgery later on in life. And a lot of these kids that are playing sports, and I remember you said baseball. I remember coaching baseball and having kids that had the Tommy John's procedure or fought through, some kind of a bone spur or something like that, and I just remember the kids saying, I want to play, I want to play, I want to play. And then here comes Dr. Labashi saying, a lot of times if you correct that problem while these kids are still young, they're not going to need the joint surgery. So I think you mentioned the sports physicals are so vitally important to these kids. It's not just to check the box to be able to play sports for the year. So it's really, really important. So as we kind of progress towards the fall, what are you thinking about with your patients? I mean, flu season, we already had our first case of flu, I think, a week ago in the hospital. Think it's going to be a bad season, and how do you feel about getting the flu shot and those kind of things?
Yeah, so just in my practice and in the hospital, I've seen an uptick in COVID cases already. And I think that, that's anecdotal. I don't have the data in front of me, but I would say that, we could be in for a flu season that has a burden on the community, that people are feeling, ill, and it's kind of spreading around. I highly recommend that everyone gets a flu shot this year. I think, especially important if you're on medications for, diabetes or other chronic conditions. The flu shot is your best option to protect you from a hospital stay that you could have prevented in the first place.
So I'm hearing a lot about COVID spreading around. So what does it look like, this variant? I don't know if it's, I lost track of all the names. So, but what is it? Is it different? Is it milder? Is it, how is it impacting people?
Yeah, so from what I've seen, it varies. I had a patient that I admitted to the hospital who was, basically septic, very, very ill, and she had COVID, and there was no other sign of infection of other kinds. So, it can affect people very negatively. I've also seen mild cases. I think some of the school cases that I've heard about are a little bit more mild, but I've also seen some severe cases there. So I wouldn't say we're talking about, 2020 strains where, we have tons of hospitalizations and things like that, but it's certainly not completely benign either. It's not something you want to get.
Yeah. Yeah. And all the precautions that were out there in 2020, 21, and 22 still apply. I mean, just, hand washing, avoiding big crowds if you can. And I guess, is that still the way to deal with it? I mean, although it seems like people congregate now like they used to pre-COVID.
Yeah, I would just say, that if you are going to be in a big crowd, because I wouldn't want anyone to completely miss out on fair season. I know that's a really popular thing around this time of year. I would just say, try not to, touch more people. Try not to shake as many hands. You don't have to miss out completely. If you are immunocompromised in some way, I would recommend wearing a mask because, it would protect you. But I don't think, we need to completely avoid public contact, but just, be smart about it. Like you said, hand hygiene is definitely something that is going to help lower the spread of respiratory viruses this winter.
Yeah. And then, one of the things that, at my age group, the shingles vaccine, and I understand there's been a lot of advancements in that, especially for the senior folks out there. So the idea of the prevention vaccines is still very, very much a strong recommendation for people in our community. And you mentioned fairs. I was just at one of the fairs a week ago. I think the biggest risk there is the food you eat, to be honest with you. I mean, I ate really bad stuff, but then I thought, it's only a couple times a year, why not? So it was good.
You've got to enjoy life sometimes, for sure.
Yeah.
I would never tell anyone not to eat cake on their birthday, but if you told me you were eating cake every night, I'd probably try to convince you to not do that.
Yeah. So now, as you kind of think forward about your practice and being a part of this community, you had already mentioned that you're going to start seeing pediatrics in our pediatric office. You know, what do you see as your ideal practice? You know, this journey that you've taken that's been a long one, right? What's the picture of your success?
You know, I think my ideal practice would be a mix between some pediatric, some, you know, mid-age adults, and some, you know, 65 plus patients. I think I like to see a good spectrum. But in terms of just like an overall goal, I'd really like just to have a group of patients that I could have open conversations with, that are willing to hear me out when I say that we have to take action about something, and are willing to, you know, confide in me on those really tough days. You know, I think that's my ideal practice. I'd really like to, you know, keep practicing in Bristol my whole career. I've loved it so far, and it's only been a month, and I really plan to stay here. So
That's awesome.
I think that, you know, kind of encompasses my ideal practice, and also some hospital too.
Yeah.
Just to, you know, like I said, keep the skills and really help the sicker patients.
Yeah, it's interesting, you know, today a lot of physicians are employed, and so it's really, really encouraging and exciting to hear you say you're going to stay here, because one of the issues I hear from patients all the time is, I established this relationship and this physician left. And with the you know, kind of the rising employment of physicians in the community, you know, it's easier for physicians to leave the community and go somewhere else. And a lot of times it's very much important for them to do that, because maybe they have kids and now they need to have a family support structure. I've seen that so much, but it does create all kinds of questions. So good for you, and good for Bristol community, because you would stay here. So tell me, any predictions on the national baseball? Who's going to win this thing this year?
Oh, geez. If I had to put my finger on who, I would say maybe the Tigers, or the Dodgers haven't been playing very well, but I think they have a decent chance. I'm a fan of the Yankees. I wish, you know, the Yankees would win, but I just feel like we're a little bit below the level of last year, making it to the World Series, but one can hope.
Yeah. Well, this is a really cool time of the year, because you got the beginning of the NFL season, and then the baseball season is kind of wrapping up. Any last thoughts for the viewing audience?
I would just say, you know, if you're looking for a primary care who cares and is part of the community, come see me. I'm happy to serve the whole family.
Dr. Patrick Smith, seeing new patients, and really exciting start for his primary care career here in Bristol. Thank you. This is Bristol Health Cares. You can reach us at cares@bristolhospital.org. You can write me for things that you'd like us to talk about on the show. And most importantly, I want to thank Nutmeg TV. This is a community organization that really only exists based on your support, the community support. So please, 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 when you're thinking about donating to charities and charitable organizations and organizations that are nonprofit, put Nutmeg TV at the top of your list, because they do a valuable service for our community. And until the next time, this is Kurt Barwis signing off, and have a wonderful day.